It's time for DocTalk Radio, brought to you by Gilbert Hospital and Florence and Anthem Hospitals. I'm Dr. Ann Borik, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio, sponsored by Gilbert Hospital and Florence Hospital at Anthem. Today we have a great show in store for us. We have actually two groups of guests, and the first segment we're going to talk to a couple people who are in the studio who are chaplains, and then the second segment we're going to focus on hospice. And so I think this is really going to be a very informative show. Those of you that are listening, I just want to put the phone number out there, 480-745-1033. Just so that you know, if you have any questions or comments, feel free to call in, chat, join in the conversation. I'd like to introduce to you our guests in the studio. I have two chaplain guests who are friends of mine and who actually are, in my mind, a very, very huge part of the team who ministers to our patients. Irene Broderson and Gail Torres, thank you for being here.
Thank you for having us.
Gail, why don't we start with you, Gail? Just tell us a little bit about your background and your training and so forth.
Well, I have a doctorate in Christian education, and 2 years beyond that to be board certified nationally as a chaplain, and then a year beyond that to be certified as a teaching chaplain. Our hospital is a teaching hospital for chaplains as well as medical personnel.
Wow, that's great. Irene.
Okay, well, I have a doctorate in theology, and as Chaplain Gail, I am also a certified teaching chaplain, and I am actually Chaplain Gail's counterpart for Maricopa Integrated Health Systems. She serves the medical center, and I serve in the Department of Psychiatry.
Wow, okay, that's great, because we're going to get into some conversation about what you do, who you minister to. Let's just start out with, what is a chaplain? Can you just define what a chaplain is?
A chaplain is part of the medical team, someone who's trained in their field to help the staff, the patients, and the family deal with their emotional and spiritual concerns. Because health is not just about medical. It's not just about the body. If a person is upset or if they are feeling in spiritual conflict, then their pain level is going to be different. Their ability to respond to the instructions from the doctor is going to be different. And whether or not they leave the hospital AMA is going to be affected because they might want to get home to their family. And we can help with all of those things.
Wow, that's great. So, you don't only minister to patients, you minister to staff as well, family members.
Correct.
That's huge. That's huge. Today we had a meeting at the hospital and we're talking about readmission rates, and really trying to hone in on, how do we keep our patients out of the hospital safe, getting everything that they need. And I see that a chaplain would be very instrumental in helping to do that, helping keep our satisfaction rates. Can you speak to that at all? I mean, do you agree with that? Is that kind of in alignment with what you do?
I would agree with you, Dr. Borik. I know in the Department of Psychiatry, almost all of the patients that I interact with and serve have issues of unforgiveness, resentment, and bitterness, hatred. They feel abandoned. They feel isolated. So there's a lot of underlying things deep within the soul that a chaplain may address. And we don't just redirect a patient, but we actually sit with them and we hear their story. We listen to what they're saying, and then we develop a spiritual care plan for them after we prepare a spiritual assessment to meet their needs.
And the big piece that Irene just mentioned is we hear their story. We, more than anything, provide a listening presence. We hear the story of the soul, how they got to where they are, what are their concerns right now. And we relay those as best we can without breaking confidence, because we are ordained clergy, so we have that clergy confidence. But we try to introduce the person to the staff, not, the motor vehicle accident
or the
traumatic
illness.
brain injury patient in room 205, but a person, their journey, the things that are important to them.
That's huge.
Yeah.
Now, let me ask you, are all chaplains ordained ministers? Or tell me a little bit about, because a lot of people think that chaplains are basically Christian. And I don't know that that's true, or is that? Can you speak
Well,
to
a
that?
lot are. There are Protestant organizations. There's the National Association of Catholic Chaplains. There's the National Association of Jewish Chaplains. Chaplains come from many different faith groups, but I would wager a guess, without having done the research, that the majority of them are Christian-based.
Okay. But certainly we can minister to all faith backgrounds.
Absolutely.
Absolutely.
Okay. And that's what you're trained to do.
Yes, we are.
Right. Okay.
There's a term that they use in Japan called kokorono care. It's the type of spiritual intervention that people did there after the tsunamis and the
Ooh,
earthquakes. And what that means is heart-to-heart care.
Nice.
My heart ministers to your heart, and it doesn't matter if we speak the same language. It doesn't matter if we are the same faith background. We communicate heart to heart.
We connect.
We do. It's interesting that you would say that Chaplain Gail heart-to-heart ministry and service, because when people are brought into a hospital, that's some type of distress. There is a trauma. There's
Sure.
something that's happening. And it's very unfortunate that most people think grief work is basically intellectual. And actually, so much of it is not. It has to deal with the heart. It has to deal with your feelings, your emotions. And so you really have to get your head and heart working together. Whereas in the Department of Psychiatry, I see so many patients, they're spewing off in the head, but they've suppressed the emotions.
Yes,
And
yes.
so what we do, really, we connect them to the emotions in the spirit, soul, and body. That's what we do. We work, I guess, for a lack of words, holistically.
Right.
With
Yeah,
the
in a
whole total
complete
being.
way.
Right.
In a complete. Can you share? I know that I'm sure that you have stories that are just unbelievable. I would love to hear a couple stories. I mean, do you mind sharing what? I know you don't have to. You don't want to get in too specific, but just to give our listeners a little sense of really what a chaplain does. What is spiritual care and how that transforms somebody that is in our hospital and really opens and allows for healing to occur. That's kind of how I see it.
Well, I will give you my most touching example, touching to me, because the comment that the mother of this patient made was probably the highest compliment I've ever received in all my years as a chaplain.
Wow.
But it's also an unusual case because I didn't actually minister in the traditional sense, in that I didn't pray with the mother. I didn't provide any kind of sacrament or service or anything like that. But I provided that heart-to-heart listening presence that she so needed. Her son was in an accident in one of our ICUs in a coma.
Right.
In order for her to be there to help him, she had to be thousands of miles away from her home and her family in an instant to provide for him, make his medical decisions.
Right.
And at one point, she felt that she wasn't being heard. And she made some complaints around the hospital. Then all of a sudden, I hear this knock on my door, and it's this mother. And she says, I came here because I knew I could find someone who would listen. And she sat down for a while and told me her story. And I said, well, I don't know that I can change any of that, but if you will give me the opportunity to try, I will. So I went and talked to the people that I thought might be able to solve the problem. It wasn't a matter of poor care. It was a matter of communication.
Right. Which is oftentimes the case.
Exactly. And that patient was at our hospital for a couple of months. The good success story in the medical outcome, good success story in being able to get her issues answered. And when she left with her son, she gave me a thank you card that said, thank you for being my soft spot when I fell. Thank you for being my family away from family.
Wow.
That's exactly what we were doing in things like checking on her every day, sitting with her for lunch once in a while, mailing her stuff back to her home because her son was airbagged.
Right.
Is that ministry? She thought so.
Absolutely, absolutely. I mean, that's a great testimony to what you do. Irene, I don't know if you wanted to share something. I know you work with a lot of the psychiatric patients, and
Actually, you know, I really thought about that when you had asked me previously, and I happen to have found this entry that I made. You know, I kind of journal, and this was something I had actually since 2003.
Wow.
And I'll just kind of skim through it and just let you know a little bit. I had actually walked on one of the units, and as I came on the unit, I could hear a woman screaming and hollering some really bad obscenities. And usually when I hear things like that, immediately I think hurt people. Healed people help people. But I knew this woman was hurting. So what I did is I walked up to her room, and I noticed that she had a one-on-one. There was a staff person that was there with her for whatever purpose or reason.
Right.
And what I did was I just observed her for a few moments, and then I took off my lanyard, my pen, my pad of paper, and I gave it to the behavioral health tech that was there.
Right.
And I actually asked if I may go into the room, and they said yes. So I went into the room, and I sat next to her. And she just glared at me, and she had such hatred, she was just spewing off these words that, you know, most people would probably ran out the room or called, there would have been some conflict
right. Called a
going
Dr.
on.
Strong or something, right?
Give her a shot of Haldol, you know, whatever it was.
Exactly.
But you know what? But I just looked at her, and I could just see the torment. I could just see the torment deep within her soul. So she started yelling out and saying, you know, I don't need to be here. I don't belong here. I have my friends. They're going to help me. I don't understand. They say I'm crazy. I'm not crazy. My family petitioned me. They put me here. They don't understand what they're doing. And there's nothing wrong with me. And they're treating me like an animal. I feel like I'm a prisoner. And she was just going on and on and on. And then finally, after she quieted down a little bit, I looked at her and I said, have you been raped? And she just looked at me, and tears started just streaming down from her eyes, and she just started sobbing. And she said, I have been raped by my father so many times and beat so many times by my mother.
Wow.
I can't even remember. My father and mother were addicts, and they actually sold my brother and I to individuals so they would be able to acquire money to buy their drugs. And so from that point on, we started our relationship. And the result was she was with us for several months, but we did develop a spiritual care plan.
Thank you, Beverly.
And she was eventually released from the hospital. And this woman was filled with a joy and a sense of belonging and knowing what the difference was between spirit, soul, and body, and what the medicine was there for and how important it was for the organic part of her, but how she needed to forgive and how she needed to understand what it meant to have this type of deprivement deep within her soul, because she felt love deprived, accepted, and belonging somewhere. She just felt she didn't have that, and she wanted to blame everybody in the world for her hurt.
You know, it's amazing because we see patients, you know, all the time that are distraught, that are, you know, we get sitters and but oftentimes we don't open the book like you did and, you know, and really kind of confront it. And that's why I really feel that the chaplains, spiritual care directors, spiritual care providers in the hospital, it's a huge piece of the puzzle to provide health care and healing. And so that, you know, I think that just speaks volumes to, you know, to that. Let's just talk about the word spiritual for a moment. And I know we have a question. I just want to get the definition of spiritual. Can you define spiritual for me? I think we were talking about, you know, something where it brings a sense of sense in your life. Or define it. How would you define spiritual?
Well, every single human being is a spiritual being, whether or not they belong to a recognized faith group.
Right. Because
they have an inner longing to belong to the world around them, to belong to something meaningful and that a creative force in the world for good. And the woundings that come when things that barricades
when that's
come
disrupted.
up. When it's disrupted.
Right, right. So meaning in life. I mean, have feeling belonged, feel
Right.
like you belong, and,
Right.
and that you have meaning and purpose in your life.
Exactly.
Basically.
That's what it
Meaning
is, yeah.
greater than yourself.
You wanna talk
Very
about
easy
them
for
on
us
there?
to think about
Interesting.
our meaning being our own. But most people, especially when faced with a life-threatening illness or accident, will tell you they need to know there's more
Gilbert
than
and
just
Florence.
them.
Very interesting. Well, I'm sure we have some calls and some comments that I want to get to. And so just in a moment when Joe gets off,
Where are you calling from?
we'll talk about that.
Yeah, thanks, bye-bye.
Joe, do you have some questions?
We do. We have a couple. Beverly from Phoenix called, and she's going to be going to one of your hospitals, and just wanted to clarify that when you were mentioned somebody was screaming out obscenities and all that. So we're not talking about Florence and
No.
Gilbert hospitals.
No.
We're
That's-
talking generally because you do this all over the place, right?
Right.
Well, let me just make a comment. At Florence and at Gilbert, we don't have a paid chaplain on staff there. Tell me where you work. What hospital are you from?
Maricopa Integrated Health Systems,
Mm-hmm.
and I serve in the Department of Psychiatry, but I also provide services to the medical center when Chaplain Gail
Right.
requires me or I get a consult.
So right, that's downtown.
And I'm at the medical center, but we also have 15 clinics throughout the county, and we do our best to get out there
Right.
and minister to those folks.
That's
too.
great. That's awesome.
But we are the safety net hospital for those who can't afford medical care or who may be in very traumatic situations. So we would get patients that need excellent care but can't go to Mayo,
Exactly.
can't go somewhere
Can't
else.
afford it.
Can't
Just-
afford it. Right.
So,
Right.
yeah.
That's
And,
great.
and we appreciate that question. That was a great question, Beverly from Phoenix. But you can be assured that when you go to Gilbert Hospital and Florence Hospital at Anthem, you're going to be getting some top-notch treatment, and they are wonderful hospitals, as you know. This could have been happening at a state hospital or a psych ward or somewhere, but generally speaking. But thank you anyway. Betty from Globe would like to know: do the hospitals, Gilbert and Florence, do they have chapels in them that you can go to pray?
That's a great question. And Betty, thank you for that question. Right now, there's a space that we're in the process of creating that I would like to call a meditation space. And I think that's really not only for the staff, or I should say not only for the patients and their family, but for the staff as well. So in Florence, we're actually in the process of creating that space. In Gilbert ER Hospital, there's the family room, which is kind of tucked away, and in that place is where there's a lot of inspirational books and a lot of different, modalities, and there's some video and music and so forth. And we are not a faith-based hospital, so we don't have a chapel or anything like that in our hospitals in Gilbert or in Florence. But I think that it's important to really kind of create that space, to have. And I think that's another reason why I wanted to talk to you and have you on the show, to really speak to the importance of chaplaincy, spiritual care, because we have to minister not only to the physical body, but to our spiritual beings as well. And I think that's huge. One of the things I just want to comment before Joe comes back is that we have a wellness center at our hospital, and we have our staff there. And I heard you say that you minister to the staff. Tell me about that. Is that a big part of your practice or your day?
I would say it's about 50% of my day.
Absolutely, 50%.
Really? To the staff?
Yes.
Absolutely.
Nurses.
And their families.
Ministry occurs in the parking lot, the cafeteria, the hallway, the
Elevator.
ladies' restroom,
How
my
neat.
office, wherever. Oh, chaplain, do you have a minute? Is probably the most heard phrase I hear all day long.
Wow.
And they want prayer for family members or something coming up. What we tell them in new employee orientation is, we know that you leave behind your financial, medical, family problems. Some of you are working 2 jobs, some of you are going to school, and you leave all that behind to come and minister with us to our patients. But everybody has to know that there's some place they can go, especially at their job when it's so high stress, that they can just be themselves and let it go for a moment in a safe environment, then pick it back up and go back and do the excellent work that they do.
Isn't that neat?
And that's what we
Absolutely.
do.
Yep. And the other nice thing about having a chaplain in a facility is that, as Chaplain Gale said, we're a safe place, but we are ordained ministers. And so we have 100% confidentiality. Whatever they share with us, we do not repeat. They are not going to be held accountable for something. You know, they might vent and say some things that may be inappropriate, but that's okay.
Right.
Because that's what we're there for.
Now, do you have access to the medical record?
Yes.
You do. Okay, so you really are a part of the integrative team that delivers health care to our patients.
Yes.
Right. We're part of the interdisciplinary plan of
Excellent.
care.
Wow, that's great. While he's getting that call, one question that I have, JCO, you know, the Joint Commission, you know, for hospitals, is it required to have a spiritual history, or kind of shed a little bit of light on that? Do you know?
JCO has changed in their requirements over the years. Currently, they don't require that you have a chaplain, but they do require that you address the emotional and spiritual needs.
Okay.
And without a chaplain,
It's
who's
hard
going
to do that. Right.
But they do require that you provide for the needs of the patients.
If the patient requests it.
Exactly.
Right. Okay. That's yeah. Boy, that's really good.
Can I put you on live?
I think we have a call.
Thanks, Jacob. Bye-bye.
Okay, a couple more questions here. Ali Mahad from Mesa has concerns and wants to know if the hospitals are Muslim friendly, and since he's had bad experiences elsewhere, he wants to know if he can bring in his own spiritual leaders, or do they have to use your appointed ones?
That's a good question. Well, let me just tell you that at our hospital, like I said, we don't have a chaplain. You know, we don't have a chaplaincy program at Gilbert or at Florence right now. But I would love to hear your comment in response to his question.
Well, you know what? I'm so happy that he asked that question. I'm just delighted because actually Chaplain Gale and I, we absolutely network with all of the well, not all of them obviously, but a lot of them in the community. The spiritual leaders are available to us, and we have Islamic leaders, the imams, who come and actually work hand in hand with us. I call them, matter of fact, when we go to the units, we give them their Qurans. And if they would like to have a prayer rug, if we have them available, we make sure they get them. We call up the imam, we share with them what we have done, the sources we've provided, and then they come over and they provide the rest of the service and the ministry to their people.
We also look at what traditional practices would make them more comfortable, and if there's any way we can accommodate them, we do. And we also make sure that dietary knows what type of food they should be eating at their request, and we make sure that there's an interpreter if they prefer to use a language other than English. And we make sure in any kind of grand rounds that we attend that the staff know of the traditional practices and beliefs of this patient, any that might affect their medical care.
That's fantastic. I mean, that's really, really enlightening. Joe, any other questions?
Yes, Jacob from Apache Junction has a brother in Florence prison and wants to know, are chaplains available in the prison wing?
Yes, they are. Chaplains are available in the prisons.
In the prisons now.
In the prison wing at the hospital.
At our hospital. What is his name, Jacob?
Jacob from Apache Junction.
Jacob, thank you so much for calling, because we are in the process of developing a team, especially for that purpose. You know, a ministry, a prison ministry that you know will provide those services in the hospital, especially at Florence Hospital at Anthem, on the correctional unit. So, in fact, was it last week? It was on Friday. I had the chaplain from the prison come and tour our hospital. And, you know, just to kind of open that conversation for exactly that, you know, to have that provided to our patients. So,
Well,
yes.
Irene and I have both gone through, we're in Maricopa County, the Maricopa County Sheriff's Department training for chaplains, which requires an FBI background check and fingerprint check and an annual recertification. And so we had to do that in order to be badged to visit any prisoner in our facility. So a regular chaplain that hasn't gone through that cannot visit, but Irene and I can, because we've gone through that extra training.
Do you have to have a little karate background too, or?
Nope.
Just thought I'd ask.
Any other questions?
No, right now.
Okay, okay. Actually, we're going to kind of wrap this little segment up. I wanted to just open it up if there's any other comments or anything else that you want to talk about, just as it relates to chaplaincy in the hospital chaplains.
Well, I think the chaplains, I think this is a very important component, and I understand the doctors have it and the nurses do, and behavioral health techs and CNAs. I just think people, they really have to have a heart for this. Somebody just can't come in. We get so many people that we hear of who say, I want to be a chaplain, and they just want to come in for the money. And actually, you don't come into the chaplaincy for money. You come into the chaplaincy because this is who you are, and this is like a calling. This is your life, and you really have had to experience a lot of adversity, maybe in your own life. I'm not saying everybody does, as far as chaplains go, but I'm just saying that your life experiences
absolutely lend
are important. Absolutely, yeah. It's
the best
so
chaplains are wounded healers.
Mm-hmm.
Very good. Very well said.
Mm-hmm.
Yeah.
Can you think of anything else? We have a great chaplain team at Maricopa Integrated Health System. We have a great interdisciplinary team, and we are just so honored that we get to be a part of it. And we work very well together.
That's awesome. Just to speak to the technique of bringing music to the bedside, bringing prayer, moving prayer, those kinds of modalities, I think, lend to the tools that you use at the bedside.
Prayer is a very big part of what we do. At our hospital, we have prayer boxes in every waiting room, in every nurse's station, and I have baskets full of prayer requests that we put on the altar in our chapel and pray over.
Wow.
And plus, the doctors will allow us to move, even in ICU, to bring a whole family in and pray a rosary service at bedside for a Catholic patient, if that will bring them some comfort.
That's awesome.
So the staff has learned the importance of prayer. We certainly know it. We wouldn't exist without the power of prayer.
That's
absolutely,
awesome.
Absolutely.
I think with that, let's bring this little segment to a close. Joe, any other questions or comments out there?
No, but we have a prison chaplain on the chat.
Oh, good. Okay, maybe we can grab some connection there. That would be fantastic. Irene and Gail, thank you so much for being here.
Our pleasure.
You guys are awesome.
Thank you, Dr.
Thank you.
Borik.
God bless.
Thank you.
All right, we're going to jump to a quick break here. You're listening to DocTalk Radio on KQCK radio station out here in the beautiful Santan Valley, Queen Creek, Phoenix, and the world.
Are you ready to start taking control of your future and maximize your earning potential? Central Arizona College has smaller class sizes and personalized attention to help you compete in today's tough job market. CAC now serves Santan Valley and Queen Creek. The CAC Santan Center is located in the shops at Copper Basin on Hunt Highway, behind Barrow's Pizza. Stop in and see how taking classes at CAC costs a fraction of a state university, and your credits can transfer. So, if you want to earn real money, you need to learn real skills at Central Arizona College. Enroll in classes today by calling 480-677-7825 or visit www.centralaz.edu or call 480-677-7825 or visit www.centralaz.edu. Central Arizona College, your way. Our family pets are such a big part of our lives. That's why Kelly's Critter Clips of Queen Creek and Sun Lakes has been providing pet grooming services for over 10 years. Your dog's comfort is very important to us, so we take the time to treat your pet with care, love, and professional attention it deserves. We welcome any size and breed and feature shampoo and conditioning, styling, flea and tick dips, ear cleaning, nail trimming, and so many other services that will leave your pet looking good and smelling good and feeling great, all at an affordable price. Located in Queen Creek and Sun Lakes, call now for an appointment, 480-655-5066. Kelly's Critter Clips. When you visit Hill Family Dentistry in Santan Valley, Dentist Dr. Tim Hill provides each patient with personalized, gentle care that you deserve. Our entire team is dedicated to providing you and your family with services that will make you smile. With a full range of general, cosmetic, and specialty dentistry services that will keep you and your family smiling. Our commitment to our community is to provide outstanding oral health. Hill Family Dentistry is located on 36359 Ganzel Road in Santan Valley, diagonally across from Banner Ironwood Hospital. Evening and weekend appointments available. We accept most insurances and have in-office policies available for non-insured. Contact us today at 480-588-8127. Hill Family Dentistry.
Welcome back to DocTalk Radio, sponsored by Gilbert Hospital and Florence Hospital at Anthem. Well, I'm sure if you've been watching, we made a quick chair change here. Right now we have a different group of people in the studio. I'd like to introduce you to the folks from Hospice of Arizona. Let's just go through. I'm going to just first of all introduce you individually. We have Ann Parsons, who's the Provider Relations. Mm-hmm. Peg Brannigan, welcome.
Hi.
You're the manager of the inpatient unit.
Yes, one in Greenfield.
And Chris Willis, who's the director of palliative care and social worker. Okay. Well, we're going to get right down and into it. And at the break, we were talking about the comment that was made prior, and I just wanted you to maybe speak to that. The gentleman who was calling about who's a Muslim in his faith. Just share with what you had said to me.
Yeah, we recently had a gentleman on our unit that was of the Muslim faith, and he only spoke Farsi. Mm-hmm. What was really wonderful was we do have a provider relation that is a Muslim faith, and she was wonderful. She was an interpreter.
Very
and
good.
We also called the imam in to help deal with his faith issues and everything else. So it was really wonderful. So we at Hospice of Arizona do provide that type of service for the families.
That's great.
Yes.
So when we say we minister, to the spirituality of our patients, we do.
Yes,
whatever their faith base and background is, that we try to provide to each individual.
Absolutely. Okay. That's an important concept at admission. We find out what type of faith they are and really go out of our way to make sure that they do get that service.
Great. Ann Parsons, I want you to introduce yourself and give us a little bit of your background, and maybe you can shed some light on what is hospice. Maybe we can start out just talking about defining hospice.
Thank you, Dr. Borik. My job as provider relations coordinator, many times I'm the front line in dealing with the families. Okay. So what happens is I call on hospitals and physician offices and provide education on hospice services, the hospice benefit, and what it takes to qualify. A lot of times I'll call on them, have the relationship, and then when there's a patient that they think is possibly appropriate for hospice, then a lot of times it'll be myself and a nurse that will go in and meet with the patient and the family and explain what services are available. Right. So it's really a privilege to get to explain it. And many times these families and patients are in crisis, and they've just been given news that their loved one or they themselves have a prognosis of 6 months or less, and it's just deer in the headlight, panic. Right. What do we do? Where do we turn? I don't want to die, kind of thing. So it just gets very complicated, and it's fantastic. There is a benefit out there like hospice for people who are appropriate. And I was talking with Chris Willis, our social worker, about how she explains it to patients and families. And the key thing she was saying is it's comfort care, and not just physical, but spiritual and emotional as well. And Chris, go ahead. You say it much more eloquently than I do.
Well, when I meet with families, I've been with Hospice of Arizona for 12 and a half years. Right. So when I started, I met with the families, and my goal was to find out what they know, because I couldn't begin a conversation until I knew what they knew about their physical situation. So when I describe hospice services, it's a treatment method. Just like aggressive treatment, when someone falls, maybe they break a bone, they go to the hospital, they seek treatment. Right. Hospice is a treatment method. It's under comfort care. So individuals, when they look at comfort care, they think everything's going to be taken away from them. They're not going to have anything. And that's exactly the opposite of what we do.
And I think that's important for our listeners to hear, to really be educated on what is hospice, and because certainly nobody wants to enter into something where we're not going to be, treated. And I think that's important.
Correct. And as we explore what hospice is, we're asking those questions are, what is important to you as you begin this journey with your, what your doctor has told you, what is important to you, and exploring that. And then we begin the discussions. So individuals, important things that they need to know is, if there's an infection, are we going to treat that? Yes. If there's discomfort, are we going to, take care of that? Hospice is all about the relief of suffering, not just physically, but like Ann said, spiritual suffering, emotional, psychosocial, all those pieces cause pain and discomfort.
Let me ask you, if somebody is at home on hospice and let's say they needed to go get medical care, the emergency room oftentimes is that an option, or is there an inpatient? What do you provide? What are the recommendations?
Hospice of Arizona actually has 5 inpatient units. We have 3 on the west side. We have one in Scottsdale, and we have the one that I take care of. It's one of our newest ones, and it's in Mesa. It's actually on Southern and Greenfield.
Okay.
And that's our newest one. And that's what we do. The patients would come to us instead of going to the hospital. The way I like to talk about our inpatient units, I call them a hospice emergency room.
Okay.
They are staffed with hospice nurses that understand hospice care and understand what hospice emergencies are. And we're open 24/7. They're staffed by RN, CNAs. We have hospice chaplains there. We have hospice social workers. We have a hospice doctor that makes rounds all the time. We accept patients 24 hours a day. Right. There's no problems with that. What is nice though too is we deal with the patients on a daily basis, and our newest inpatient unit is 14 patients.
Okay.
But we have 12 private rooms, and we only have one semi-private room. And it's a wonderful facility. The staffing there is fantastic.
So what I'm hearing is that if somebody's home on hospice and they need more medical treatment or medical care, you have what's called a hospice emergency room, if you will.
Right.
And it really helps keep them out of the emergency room and in the hospital, which I think is really kind of the idea, to really streamline and keep that patient comfortable, as comfortable as possible.
Sure. They don't have to go to the emergency room and maybe wait 6-8 hours in the emergency room. They can come to our units and be treated right away.
Right.
And Dr. Borik, that's what I explain a lot to families that's really the purpose of probably 90% of our hospice patients at Hospice of Arizona are what we call routine home care.
Okay.
So they are at home. They're not in our inpatient units. They're at home. And they have a diagnosis of congestive heart failure, COPD. And many times what happens is an exacerbation.
Yep.
And when that starts, families, a lot of times, the only care, it's always after hours or on the weekend.
Correct.
So they call 911, or the family member puts them in the car, they drive them to the ER. The whole purpose of getting hospice involved to begin with is our nurses go out at least twice a week. More if the patient needs it, less if they don't. But the average is twice a week. They are the eyes and ears for the doctor. So if they listen to those lungs and they're starting to fill up, or they see that the ankles are swelling,
fill up with fluid and so forth,
our nurse is on the phone to the doctor in clinical terms, telling the doctor what she sees, what she hears, and many times she will hang up, call the pharmacy, and that medication gets delivered to the house that day
immediately,
and we're starting to treat immediately.
That's great. That's great. Joe, do you have any questions?
We do. We have a few that are lined up here. First of all, we've got a comment. Somebody on the chat just wanted to say, my family recently had to use a hospice service, and it was the best choice we could have ever made.
Fantastic.
They took care of the patients from their hearts, just like the chaplain stated previously. Thank you.
Very nice.
That was nice.
Then we had John from Glendale, from the hospital in Glendale, California, said you have to be great people to be chaplains and hospice workers. You really have to be nice people. God bless you all.
Oh, that's sweet.
And then Melvin from Sun Lakes said, is there any charge for hospice at Gilbert Hospital? And thanks for all the info so far. I didn't know what road to take, and now I do.
Wow, that's a great question. Why don't we address that question?
Hospice is a benefit underneath Medicare. And how it works, most of the hospices follow the same pattern. So I'll share, hospice is billable to Medicare. Anyone is entitled, regardless if they meet medical eligibility, to be evaluated for hospice. If they don't have Medicare, it's private insurance. And if they don't have private insurance, we won't deny an individual. And we take great pride in that.
Say that again.
Okay.
Because that's huge, and I want our listeners to hear that.
Okay, so at Hospice of Arizona, hospice is a service billable to Medicare or private insurance. If their insurance does not pay or they don't have the ability to have an insurance, we take them on for free.
Right.
So we won't deny an individual. And so in regards to Gilbert Hospital, we can come in if you ask your nurse on the hospital that you want to have an evaluation for hospice. You just tell them, and they'll call us and get an order for us and put it on the chart for us to come and evaluate to see if they have met medical eligibility.
And
or
there's
not.
no charge for that. We do that all the time. We write, a consult. I have a question though. If I have a patient that is kind of thinking about hospice, and from a medical perspective, certainly they meet criteria, but they're not quite there yet, and they say, well, I want to go home and think about it. My sense and what my experience has been, it's hard to access hospice after you're discharged from the hospital. Is that true or false?
This is the best part of what I get to do is formalizing our palliative care service.
Okay.
So regardless if someone meets medical eligibility or not, if they make the call to us, we will continue to follow up with them as they see fit.
Got it.
We believe to the nth degree that this is patient-driven care. Whether they're on hospice or whether through our Connections program, we want to make sure if they're not taken under care of hospice, that their needs are taken care of regardless.
Okay.
That's great. Okay. So even if they wait a few weeks, a few days, they can still access and get in touch
Oh,
with you.
absolutely. They can call us 24/7
That's
at
good.
any time and request follow-up.
That's fantastic. Can you be a full code and be on hospice at the same time?
Absolutely,
Okay.
absolutely. That's a patient choice. They can certainly be a full code and be on hospice.
Okay, because that's a misnomer. I think a lot of people think, well, they have to be a DNR, do not resuscitate, in order to meet criteria to be on hospice.
Right.
So that's important.
But the DNR, what that means is if your heart were to stop or you were to stop breathing, that you're dying, right? But with a full code, they can certainly be on hospice.
Okay,
Right.
that's great. That's good to know.
Got a good question from Mary Lou out of Tulsa. Would like to know if there's a web-based or internet place that she can go to find a connection because she has no idea how to get into the hospice for their aunt.
Absolutely. In Oklahoma City, we have Frontier Hospice. That's part of our American Hospice umbrella. So she can go to www.americanhospice.com and explore, as well as if they don't serve Tulsa, they can Google Hospice of Tulsa and get details of the hospices that serve that area.
I'm amazed right now.
Yeah, that's fantastic.
Not that exists, that you knew that.
Oh.
That's awesome. Thank
Been
you.
there a long time.
American Hospice is pretty big, right? Yeah.
Yeah, we have hospices that are actually throughout the United States. Our main hub is out of Jacksonville, but we have hospice in Texas, Oklahoma, Virginia, New York, Boston, and Philadelphia, and of course, Arizona.
Okay. One other question that I have: do you follow patients in prison? Is there a hospice?
No,
in
but
prison?
one of our former admission nurses goes to the prison, and they provide the full range of care, palliative care, etc. So as long as someone is in a prison, they will get the support and the comfort care that's needed as they're in their end stage.
Great. Okay, that's good to know. Let's talk about palliative care for a moment. Let's say there's a patient that doesn't quite meet criteria, and maybe you can speak to, maybe give me an example. Can you just maybe?
There's many examples. Let's say, for instance, a patient was diagnosed January with pancreatic cancer. She was working up until then. She went into crisis and was admitted to a hospital and actually intubated at the time. The family called me panicked because The hospital's palliative care team had met with her. They assigned a palliative care team from the community to assess. And the discharge plan at that time was to discharge Mom home with a hospice, but they were going to wean her off that ventilator in 2 days. The daughter panicked. Mom panicked. The patient she wanted to die at home, but she didn't want to die that quickly. Right. So where palliative care comes in is you can have your cake and eat it too. You can have the medical eligibility for hospice, which she met, but she wanted to still be on that ventilator because she wanted to see, is there something aggressive that I can do to just get all my ducks in a row? So what I did was I provided education regarding ventilator supporting skilled nursing facilities, as well as I educated her regarding our palliative release program from a ventilator. The first question out of that daughter's mouth was, do you guys provide medication during that process? And I'm thinking, oh my goodness, how long did she go thinking that it was going to be this painful, distressing event? So what ended up happening, this patient and Connections, that's the service that we offer, followed her. She discharged to a skilled nursing facility. She was actually taken off the ventilator in the hospital successfully, put on a CPAP. Which is a breathing machine, and sent to the facility. Within a week, the mom was ready for hospice. She's like, I'm ready. So she chose, instead of going home, she wanted to go to our unit. And she died a few days later, her way. So palliative care is the extension of what hospice does, relief of suffering, their way.
That's good.
So we follow people based on what they say. So some of the patients that we follow, they want contact every 30 days. They set it. Some are every 7. It depends on what they need. And we follow them telephonically. We may make a couple visits as a social worker. You know, that's what I do. My goal is to assess what's the most important things to them.
Very good. Very good.
Another interesting question. Sarah from Brooklyn.
Brooklyn, New York. All right.
Wants to know, can you get off of hospice if you get better, or do you have to die to get into the program?
Oh, no, there's very many graduates from hospice.
Well, that's a good thing.
Yeah, we like it when they graduate.
That's a good question.
And a lot of times the patients graduate because of the care that's provided, because it's actually, it's almost like one-on-one care, because of the fact the nurses go out there and see the patients, and they're assigned the doctor and everything else, and it's a lot of times it's the one-on-one care that they receive, that they actually can graduate from hospice.
And when I meet with families, I'll joke with them and I'll say, you know what, we're the first ones that print up the T-shirt, I survived hospice. And they get it. And, you know, we're seeing that more and more. And a lot of times what happens is there has been some kind of a health event, a crisis, and at the time, the person qualifies for hospice.
Sure.
So 85-year-old grandma who has several, you know, maybe cardiac conditions, lung conditions, and now it's the picture of this. She's going downhill, okay? And maybe she lives by herself. She's not eating right. She's not compliant with her medications because she doesn't understand it. It's confusing. She's not taking everything at the right time. She's not cooking. And if she has to be the one to cook, then she's not going to eat. So she's losing weight, maybe falls, and she's not taking her medications properly. What I tell people to look at, if they've had weight loss and several hospitalizations, let's take a look at that. Maybe that is someone who would qualify for hospice and they're not dying right now.
Exactly.
That's when we want to get involved. We can make such a huge difference. And that's what I tell people. You don't have to be dying. Let's get involved now. If you've got a medical condition that qualifies, then here's a nurse coming out twice a week, a home health aide to help with bathing.
Your quality of life becomes better.
Incredible.
It really
and you
does.
understand your illness. Your family members are educated, and many times there aren't family. And this little 85-year-old lady that was losing weight, not doing well, after 2 months, 3 months, well, grandma's put on 10 pounds, and we've kept her out of the hospital. She's feeling better. The social worker got Meals on Wheels. You know, their out-of-town family maybe that's connected. That's someone, clearly, in 3 months, you know, 6 months, we might be coming in with the T-shirt. Hey, you know what? You just graduated. But they're still 85 years old. They've still had these health problems. So a week from now, a month from now, a year from now, when the person starts to decline again, they can go back on hospice. And I don't think a lot of people know that.
That's a good question. So you really can't use up your hospice eligibility.
That is right.
No,
Okay.
originally when it was designed as a benefit, you could only have it 6 months.
Okay.
But Medicare says prognosis is not an exact science. So in that case, after the first 3 months, we reevaluate them. If they still meet medical eligibility, we keep them on for another 3 months. There's that original 6 months.
Okay.
After that, Medicare requires that we reevaluate their medical eligibility 2 months, 2 months, 2 months. As long as they meet that medical eligibility,
right.
they stay on. If they graduate, our connection service continues to monitor based on their needs and just check in with them. Do you need anything?
And then they can potentially get that 6 months back
Oh, yeah.
of eligibility if they needed it. Okay.
And you know,
Wow, that's
Dr.
good
Borik,
information.
the national average still for people to have the hospice benefit is 14 days.
Wow.
Now,
Okay.
isn't that awful?
Yeah. I think it's because it's not used enough.
No,
you know,
people
we're-
still
it's
don't understand
underused.
it.
That's
And-
right. Not only people, I think the medical profession
They still don't
needs to be
understand
educated
it. Right.
about it.
Right. They still don't understand it.
And that's really why I wanted you guys to be
Yeah.
on the show today
Right. Yeah.
to help bring some clarity to this.
Well, and that's why it's been very nice to work with you over the years at
Right.
Gilbert Hospital and other places you've gone, because you understand you don't have to be dying.
Right.
If you have a diagnosis that qualifies, many people go home from the hospital with hospice.
Right.
And that's what we do, is keep them out of the hospital and make them very comfortable and treat those things like urinary tract infections, congestive heart failure exacerbations.
And what I hear most is family members are just ecstatic. I
Yes.
mean, it really gives family members the reprieve. You know, they can maybe go on vacation. They can
Right.
maybe use the inpatient unit
They
for a
can
short
for
period of time
respite.
for respite.
Right.
Yep.
And that's 5 days of respite. Right.
Yeah.
Absolutely.
But in addition, Peg, I wanted to add that we have contracts throughout the valley at
Right.
skilled nursing facilities. So if the units are not convenient, we have contracts everywhere. And for those that are very active still in their terminal diagnosis,
Right.
even though they're real active, we look at skilled nursing facilities that have activities built
right.
in.
That's good.
You know, instead of the unit.
Right. I just want to say, you know, being, you know, at Gilbert Hospital and the Chief of Staff at Florence Hospital at Anthem, we don't have a contract with a specific hospice. So, you know, it's really up to the patient and their family to choose
Right.
what hospice they want. So for you listeners out there, you know, I just want to make sure that you understand that, you know, that this is not the only hospice that
No.
we provide in our hospitals.
Right.
You know, we can use any hospice that you would choose. But I just think that you know, you guys do such a great job, and I thank you
yeah.
for being here.
And
today.
another thing that's a misnomer too is they can still have their own physician follow. They can also have their own doctors follow. They you know, actually we do provide physicians, but they can also have their own doctors follow if they
Excellent.
want to.
We had a call from Russ from Sedona, 26 years old with MS, and he's in a wheelchair and he's very ill. Wants to know if there's an age limit.
Oh no.
If there's any age
no.
Great
requirements.
question.
Very good question.
No, there's no age limit for hospice. We do not accept peds, but there's no age limit for hospice.
Now, are there hospice agencies that do accept peds?
Absolutely.
Okay.
Absolutely.
Okay, right. So, yeah, from pediatric all the way up, you know,
Yeah.
That's good. That's a great question. Okay, you know, we only have a few minutes to go to wrap up. I wanted to just open up the floor to see if there's anything else you wanted to talk about or address before we close.
I guess I just want to say is don't hesitate to call. The one thing that individuals, I think, may struggle with is they're afraid to call and ask questions. Don't. This is your future, and you are creating the masterpiece, and you deserve to have great care regardless of the situation you're facing. And with so many families I talk to, the most important thing that I can share is I end the call and they say, this would have taken me forever to be able to navigate this without your help. There's so many resources out there. So call us. We can connect you with what you need when you need it.
And if I could jump on my personal soapbox, because I am the one a lot of times meeting with families, hospice is not about death. So many people associate hospice with death.
Absolutely.
And what I tell them, actually, it's about life. Your life and the quality of life, whatever time you have left, as defined by you. So hospice is not about giving up throwing in the towel
Very good.
or saying, I want to die. Actually, our patients are saying, I want to live, but I want to be comfortable. I don't want to keep doing, whatever it is that they're doing. It's not working anymore. And what they wanted is to be comfortable and to know that they've got help and care. And it really is a wonderful benefit that Medicare and insurance covers.
Very, very well said. I'm a big proponent of hospice.
Yes, you are.
And I think that there's no harm in just having it come and talk to the family, right?
Right.
And then let the family and the patient make a decision.
Absolutely.
But really, we as the hospitalists, as the medical physicians, internists, a lot of times we don't have the answers of what can be provided on the outside. And that's why we look to you to kind of help us answer those questions.
And I just wanted to let everybody know that a lot of us have walked the journey that they've walked. So we put ourselves in their shoes, and we know what it's like. But hospice is truly one of the best things that we can do for the people. And, we do it the right way for everyone. And it's just a wonderful benefit. I think it's one of the best hidden Medicare benefits. A lot of people don't know it, but please give us a call if you want to. The phone number for Hospice of Arizona is 602-678-1313.
I have that memorized.
If you have any questions, please feel free to give us a call. Thank you.
Very good. Very good. Joe, do we have a question or a comment?
Nope, we're good right now.
Okay. I think with that, I want to thank you. Thank you for coming out. It was short notice, and I really, really appreciate you taking the time to come out and speak with us.
Thank you. It was
Thank
fun.
you. Thank you, Dr. Borik.
I think that's a wrap, Joe.
All righty then. Do you know what next week's show is about by chance?
Actually, we're in the process of putting it together. I know that we have the superintendent of the Higley School system that's going to be on the show. We have a dermatologist that will be coming on the show talking about skin cancer, and hopefully we'll be showing some really good pictures of different moles and different things to look at, because I think really it's about education. It's about learning what to look for, early signs of of skin cancer and awareness. I think that's very, very important. We have some really great shows in store up and coming. So if you haven't logged on to our Facebook page, please definitely come on and like us, because we're keeping track of the numbers, and that's fun to do.
All right.
Facebook. What is the address there? What is it? Facebook.doctalkradio.com?
Yes, facebook.com/doctalkradio.
Okay, great.
So check it out, and Dr. Borik does a daily blog as well, and I learn every day some new things. It's a wonderful thing.
Right. Actually, just before we close, one of the latest things was talking about happiness, and how heart disease. We know that just having that sense of fulfillment in life. Chaplains were here. We were talking about spirituality. Clearly has to do with health. We're finding that people are healthier. Heart disease is decreased in people that have a healthier outlook on life, a happier outlook on life, I should say. So that's really, really important.
All right, you've been listening to Doc Talk Radio on KQCK radio station. Keep listening out for our sponsors and enjoy some great music, and I will be back with you a little later.
This concludes Doc Talk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
Doc Talk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.